Welcome to the Panza Panza Forum. In the Yoruba language, the word panza is usually injected into poetry to express an uncomfortable, uncensored, and inconvenient truth. The Panza Panza Forum is candid conversations about the life of African immigrants in America as it relates to their adaptation to their new home. While some may find it easy to integrate and can balance between retaining the original African culture while accepting the culture of their new home, many continue to struggle to find a balance between both worlds.
Hello and welcome to Panza Panza Live. This is a podcast where we discuss the lives of African immigrants and their assimilation into Western society as they raise younger generations in a country that is quite different from their own. We also explore the experiences of children of immigrants as they balance the African and Western cultures. We present to you this informative, interesting, and expansive dialogue about the intricate experiences of African immigrants in America.
Welcome to another episode of Panza Panza Podcast, the platform where we engage in a deep conversation about the experiences, challenges, and resilience of African immigrants navigating life in the diaspora. I'm your host again, Kemi Seriki, and today I am honored to welcome Dr. Nwaka Egu-Namzi, a licensed rehabilitation psychologist researcher, a clinician whose work sits at the powerful intersection of physical health, mental health, and cultural experiences. Our research examines how psychological factors like depression, acculturation, and access to mental health care influence cardiovascular and cerebrovascular health outcomes. She has also co-authored impactful studies, including association between depression, acculturation, cardiovascular health among African immigrants in the United States. The second co-author, the research she also conducted, is called Access to Mental Health Care Services as a risk factor for cardiovascular and cerebrovascular diseases mortality. The third one that we're going to also discuss today is called Depression Symptoms in Older African Immigrants with Mobility Limitation. Our work is deeply relevant to African immigrant community navigating chronic illness, aging, cultural transition, and mental health stigma. Today, she joined us to unpack the inseparable link between body and mind, address the cultural belief that shape how we understand mental health, and help us to make sense of our groundbreaking research. Dr. Nmezi, thank you so much for joining me today. It's such an honor to have you here on Panza Panza Podcast. I can't tell you how much I really appreciate you being here.
Wow, thank you for that introduction. It was wonderful. And thank you again for inviting me here. The work that I do, honestly, is a collaboration with many different researchers who also identify as African immigrants and are interested in really putting the community forward. So
Yes.
Thank you again.
And I'm so glad a lot of you first and second generation are working, understanding that we really need this research specifically focusing on African immigrants because our population is growing. And in so many ways, there's no such specificality of research focus on African immigrants. But before we even get into all this conversation, I would love to go into your background because a lot of time they just say, oh, African immigrant children, look at what they are doing, where they are. How did they get to opportunity to be where they are today? So that's part of what I usually do in the beginning so that the audience just don't think that you guys just came from nowhere or African immigrant just care, you grab the opportunity. But, there's a lot of work behind it. So for many of the audience who may want to be curious about your background, and as I always regularly ask my guests, can you talk a little bit about your background to our audience as to where you were born, where you spent most of your childhood and adult life?
Yes, that's a great question. So to begin with, I identify as a second generation immigrant from Nigeria, right? And so for some people who are unfamiliar with the term second generation, it's used to identify a person that was born in the country different from the country that their parents were born in, right? So my father came first initially to Canada, and then from Canada moved to the US, and he immigrated to Canada when he was an adolescent. And so by the time he met my mom and they moved to Brooklyn, New York, they were young. They were young, right? So my early childhood and formative experiences are from growing up in Brooklyn, New York City. I think that I would come from what one might consider an average sized Nigerian family, meaning I have 3 siblings. I am the oldest. And so we could get into lots of conversations about what being the oldest, what being the Ada, right? What that means in Igbo culture. But I'm the oldest of 4. And I grew up in Brooklyn, New York, which was such a rich experience for many reasons, but for the principal reason that it exposed me to so many different Black cultures.
Wow.
Yeah, so it was, I still go back to Brooklyn, New York today. I take my children, they go to see Papa and Grandma, and they absolutely love it. They'll tell you that all their favorite people live in Brooklyn.
Yes, yes, yes. It's good to know that you grew up in Brooklyn because as a New Yorker myself, I've been living in New York almost the entire time I've been in this country. And it's such a rich place with a rich culture. And I bet your parents will never move to any states.
When I was doing my PhD in Florida, my mom came to visit me and she said, "No, I'm going back." And I know that you've had lots of different people on the podcast, different conversations. I know there's conversations about the desire to want to go back to Nigeria to, retire. But for her, in a lot of ways, New York City is home, and that is where she is going to be.
Because New York is so huge. There's so many cultures. I mean, name it. Is a melting pot of the whole world is in New York City.
Exactly.
It's the only place, especially if you're from Nigeria, you don't want to go into a place where you can't see people. You can't even walk on the street, know. So that's one thing that New York gives you. Growing up in a Nigerian immigrant home, what would you say are some of the challenges or the struggle of being the second generation African immigrant child?
I mean, I think there are different challenges, but one of the principal challenges that comes up for me is that as a second generation immigrant child, you are really at all times navigating multiple cultures, right? So when I walked into my home, I'm in Nigeria, even though I'm living in Brooklyn, right? This is Nigeria in Brooklyn, right? I'm eating fufu for dinner. We're eating jollof rice all the time. My mom is making puff puff. Like, this is a Nigerian household. I grew up with the same narrative that there are 3 acceptable professions. You can become a medical doctor, you can become an engineer, you can become a lawyer, but you need to pick one, right? And so I grew up with parents that really had a profound understanding for the benefits of an education, of a good education. And I think one of the things that they instilled in us from childhood was do well in school, which I'm sure, right? Many second generation immigrants hear that message, right? Focus on school, focus on school, focus on school. And I think that helped me in some ways. And I think that sometimes that, myopic view of just school prevents you from looking at or exploring other things. I think, again, fortunately, growing up in New York City, there's always room for exploration. And I think that was one of the things that really enabled me to grow and identify what is it that I'm really interested in. I initially, as a child, wanted to be a pediatrician, and I told everybody, I'm going to be a pediatrician. And of course, my mom, she's going to be a doctor, right? And so when I changed to psychology, she said, "What is that?" "So you're going to be a doctor." I was like, "Okay, Mom, don't worry. I'll figure it out." But it was really through exposure in high school, right? I was fortunate enough in high school that I was able to take an introduction to psychology class. It was offered for college credits through NYU. And at the same time, I took it in high school. So it was a high school elective. So here I was taking 2 introductions to psychology because I was an overachiever and I figured I can get an A in both classes and that would look great, right? Studying for one might help me with the other one. And I remember the first time that I got a C was on my first test in that NYU class. And I was shocked. I remember looking at the paper and thinking to myself, I see this letter. This letter does not make sense to me because I didn't come from a household where you could just bring home C's. So I really struggled, and I went to talk to the professor and I said, I'm taking this class as a high school elective and I'm doing well in my high school elective, but I got a C in this class. And, his explanation was one that was really beneficial and helped me. But the introduction to psychology class at that level was the first time that I would say a subject challenged me and created curiosity, right? I think oftentimes things challenge you and that's nice, but it challenged and created curiosity. And so I look more into this, right? It was also the first time that I was introduced to the concept of mental health in a way that was very different from the conversations about mental health that we would have in my house, right? And so the conversations about mental health in my house were always kind of restricted. Either you were of someone that was of sound mental health or you were someone that was mad. And there was never any gradient. And so that class was the first time that I had that. And of course, I had to drop my high school class because I felt I wasn't learning anything. And that was really the first time that I decided to think seriously about what becoming a psychologist might mean for me.
So what did your parents said when you decide on going into psychology?
For a long time, my mom was really adamant about me pursuing a medical degree. I think my father was much more supportive. I think for him, what mattered was, are you going to get an education, right? Are you going to get a degree? Are you going to pursue it all the way? And of course, I said yes, right? And so he was accepting of that. And then when I told my mom, I said, okay, mom, I'm going to do the PhD. Okay, I'll do the doctor of psychology. She said, okay, no problem. That's fine. I think for her, as long as you answer doctor. And I was like, yes, mom, I'm going to go all the way. And I think even then, right, she didn't really understand what is a psychologist? What kind of work will you be doing? She didn't understand. They've come a long way in terms of their appreciation of mental health, right? And in terms of being able to have conversations, they're very open with me. When I have conversations with them or when I try to educate them about things, I'm able to talk to lots of family members now about different topics. I think having the title helps, but also pursuing something that you're passionate about, I think helps. And in general, they have been very supportive and of me throughout my career.
That's wonderful that you're able to change that, knowing how our experience back home when it comes to mental health, when it comes to mental illness, the way we view it back home, and there's a lot of stigma associated with it. And that actually affects us learning about it. So I know you mentioned it a little bit, but how does your cultural upbringing influence your view on mental health and for someone to seek therapy or psychological support? Were there any taboo or misconception about mental health that you may have witnessed growing up?
Of course. So I began my understanding of psychology and mental health with a very limited understanding from a cultural perspective of what it means to be someone with a mental illness versus what it means to be someone who maybe one might consider is without mental illness, right? And we understand that even that is a spectrum, but my understanding growing up was it was a dichotomy. It was either that you were well or you were unwell. And if you were unwell, right, then there was something gravely wrong. And I remember oftentimes the term that we would hear would be mad, right? Or onyara, right? Someone that has really gone mad. And when you approach mental health from that perspective, isn't it scary? It's scary, right? To think of it that either I'm well or unwell. And it limits the understanding of what can we do, right, to maintain positive psychological health? Or what are the factors, right, that play a role into why someone may need some additional assistance managing their mental health?
It's really powerful. I want us to also define that mad. Mad is like somebody who is walking around the street talking to themselves naked. In terms of how we look at it back home with unkept body, and a lot of all those things is how we perceive somebody who
Hmm.
suffer from mental illness.
Yeah.
And they
I
can
think
go ahead.
I think the equivalent, right? If I were to, when I think about it, that in, I guess, a European perspective or an American understanding of mental illness is someone with psychosis, right? So they are not grounded in reality. Their symptoms are not managed, right, with medications, and they don't have appropriate access to care. So they're not able to function in society as would be expected because their symptoms are not well managed. And that is not the case, right? We know that, mental health concerns span a broad spectrum, and it can be anything from I'm experiencing chronic stress, right? And these chronic stressors are making it hard for me to sleep at night, are creating some sadness that's persistent, are creating feelings of anxiety, right? These are the things that I think also constitute a consideration of how we maintain psychological wellness that unfortunately we don't have because we don't have the language for it. There's just no language for, you know, I'm having a lot of stress and it's making it hard for me to sleep at night, or I don't really know how to handle this situation and I'm feeling a lot of sadness, right? We don't really have robust language around that. And I think that also makes it hard for people to then take advantage of resources that may be available to improve their mental health. Because where do we even start to talk about it from?
Yeah.
Yeah.
That's so true. That's so true. And we have to also look at the aspect of using religion as a way of a coping mechanism for mental health, mental illness, whereby if you can't sleep and you may talk to somebody instead of them telling you, okay, maybe you could seek professional help. They say, let's pray. Approach your pastor, approach your imam, talk about it, whatever it is that is bothering you. So that is how we understand the coping. And like you said, we don't have language for so many of this issue. So what influenced your interest in psychology, especially in rehabilitation psychology and working with people managing chronic illness or a sudden life change event?
So like I said earlier, my initial interest in psychology was sparked from the course that I took in high school through NYU, and it was honestly the first time that I started to think about mental health broadly. And it was also the first time that the subject sparked a different kind of curiosity in me. In my early professional training, I was initially aspiring to become a health psychologist due to my interest in both health behavior change and my curiosity about how culture was an important variable in behavior change. And, growing up, I had a very dear uncle who is no longer with us, but he suffered from kidney disease. And as a child, when you're watching someone cope with the medical conditions, you don't have all the words and the tools to really understand what is happening to this person. And sometimes this still kind of brings up tears for me, but I wanted to know more, right? I wanted to know more about the factors that went into the treatment he got or the treatment that he didn't get. I wanted to know about the factors that helped someone get placed on an organ donor list who does not get placed on an organ donation list. And I think seeking the answers to those kinds of questions fueled a desire to study health inequity. What are the social and structural barriers that make it hard for people to access healthcare that they need? My uncle was a very vibrant soul, even at the time that he was going through his health and his medical conditions. And I never saw that expressed sadness, but it did create curiosity for how is he coping, right? And I remember he'd come and spend lots of time with my father. They were best friends. And social connection is a coping strategy, right? It's how you cope sometimes with sadness and with distress. And they would talk for hours. You could just see the happiness in that interaction. Prior to the completion of my doctoral degree, my father sustained a stroke. And I watched a man, when I say this man was on the go, you could not stop him to save your life. He was go, 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 go. And I watched someone slow down for the first time in life, right? And not intentionally, but because he was forced to slow down, right? Because he just couldn't engage in the same way, at least for a short period of time. And I watched my father cope with a different kind of sadness that my cultural background did not have words for.
Yes, yes.
And that kept me going, right? That kept me wanting to understand and explore what is this and how do we help people come out of this space? As an intern, I was completing my internship, health psychology internship in health psychology, and we had the wonderful opportunity to explore different specialty areas in health psychology, and rehabilitation psychology was one of those specialty areas. And I immediately fell in love with the specialty. It just felt like home. It was really another lens for me to understand how people cope with illness when illness slows them down. And so I pursued postdoctoral training in rehabilitation psychology, and I love the work that I do today. Today, I spend a lot of time talking to people who are recovering in the very early stages of recovery from many medical conditions, including stroke. And I get to talk to them about risk factors for depressed mood or risk factors for anxious mood. And some of the people that I talk to are African immigrants of my parents' generation. And for many of those individuals, it is the first time that they have ever had a conversation with a psychologist.
Yes.
And it's such a beautiful moment because it allows them in some ways to let their guard down. And it allows them to really think differently about mental health and ask questions and understand what are the things that they're doing really well that are going to work in their favor. And what are some things they want to be mindful of? Depending on the severity of the disability that you're experiencing, you may not be able to immediately return to work. What does that mean for stress? How does that stress show up? How do you cope with that stress? What happens when stress becomes prolonged, right? And so I get to have these conversations with many individuals in across the African diaspora, right? Whether they are identified as African immigrants or immigrants from other Black nations, right? I get to have these conversations with them. And it's wonderful because they have their own understanding of what it means to speak to a psychologist. They have their own understanding of what it means to talk about mental illness and mental health. And here I come along and say, hi, my name is Dr. Nmezi, and I'm here to speak to you about XYZ. Sometimes it helps, right? When they see my name and they know, oh, she's a part of the community, right? Sometimes that helps to open the door. And it helps to have those conversations, and it's wonderful to be able to share with people. There are lots of things that you're probably already doing really well.
Yeah.
Religion and spirituality, meditation and prayer. Those are wonderful coping strategies. Can we add anything else? Right. So I'm always mindful not to tell people, don't rely on your faith and religion. No, of course. Right. It's part of who you are. But how about we add some other things in the mix?
That is so powerful, the story you just told. And I see how your passion developed, because sometimes when you have personal story to tell and you focus on that as part of what your career extended to, the way you're going to conduct it is going to be with passion. And I could see that your uncle's story, your dad's story, that actually is a very, very, very powerful story.
Thank you.
And I'm so sorry that you have to experience that in order for you to be where you are.
But I think it has helped cultivate compassion and humility. I understand a lot of things about my culture, but I don't understand everything. And I think that curiosity about wanting to know more, that humility about going into them and understanding you are really the expert on your life. The immigrant story is always a diverse story. The decision to leave your country of origin and move to a new place where you might have very limited social networks is a tremendous decision to make. Calls for lots of bravery, but it also means that there's a whole backstory of the life you lived before you became an immigrant, before you left your country and you migrated. I don't know anything about that life, but that life probably informs in so many ways how you show up in this room. And it's wonderful to be able to give space for people to have that, right? And for me to honor those experiences that I may not know much about, but that I understand maybe shape and color the interactions that we're having today.
And for you to understand the cultural background, which I'm going to talk about later on in terms of cultural competency when it comes to care, that is very, very important.
Mhm.
and you are one of a few because we don't have too many. You're in the state where you are. Can we have your kind of profession and your kind of expertise in places in every state? It is something that it is so difficult to come across.
Yeah. I think I learned early on that it is really hard to decouple culture from the way people interact with their health and their healthcare system. Like one funny story that is coming up for me as I talk. I remember one time my mom, myself, and my aunt, we decided that we were going to go and try out a gym class. And my mom is not She's not one to go to the gym at all. If you tell her, Mom, let's go to the gym, she said, no, I'm going to my garden. Bye-bye, right? So she's not a gym person. But she decided to go. Me and my aunt, we convinced her. She decided to come with us. And we said, Dad, Dad, are you going to come? He said, no, I'm eating my goats. And went, right, to go and have his goat stew.
Yeah.
And I bring that up to say, because just imagine as he is, navigating his own health journey, there might be things like changing your diet, right?
Yeah. Yeah.
And how do you have conversations with somebody about how do you culturally adapt your diet? That's hard. If someone is accustomed to eating pounded yam and soup, their palate is culturally mediated, right? When you sit in front of a dietitian, do you say to your dietitian, okay, well, last night for dinner, I had a goosey soup and I had eba. Like, this is what I ate. Is your dietitian going to be able to understand, well, how do I help you modify this so that it is consistent with maybe what we would hope that you're doing a little bit more of and maybe have a little bit less of something else? And so I learned very early on that you could not decouple culture from health. They are inseparable. And so what that means is that then we do have to start to create space and room to invite culture into the conversation. And there are ways to do that. I do think that first it starts with humility and an understanding that people are cultural beings. And, anytime that you are giving medical advice, it's still cultural. Like it's culturally, it's embedded in the culture that you're in, whether it's medical culture or someone's religious culture or their ethnic culture. Right? There are these cultural facets that you really can't remove. And so there are lots of things that you can do if you're trying to understand, well, how do I help my practice become a little bit more culturally sensitive? I think, again, starting from that place of humility and an openness to invite culture into the room. There are models. There are different ways that you could ask questions, that you can phrase your questions that help people use that kind of create the space for understanding how culture might be influencing someone's behaviors or their decision making. The DSM-5, the Diagnostic and Statistical Manual of the American Psychiatric Association, we use that often in our field. And there's an interview. It's called the Cultural Formulation Interview. And it really seeks to understand, right, a person's experience, but embedded in their culture. That's one wonderful way, right? Understanding how you can modify the questions that you typically might use in a clinical encounter so that it kind of creates a little bit more room. There's another model called Kleinman's 8 questions. And again, this is just a way of getting people to talk about their understanding of their illness and then what they've been doing to manage their illness. And then I think can help you have a nice, back and forth dialogue. I think that we can tailor our medical and psychological interventions so that they are responsive to the needs of our patients. And that could mean offering diverse food options when people are talking about cultural or food preferences or cultural or food restriction. Some people may not be able to eat certain things, right? So understanding what that means, using interpreter services so patients can actively participate in their care, right? So that they can be informed decision makers in the care that they are obtaining. Allowing patients to ask questions about their health concern. And I think offering information from a non-judgmental perspective. I think people pick up on that. If they're like these subtle judgments, people can pick up on that and it can kind of create a cold environment and climate. Enabling patients to invite family members into the conversations. In many cultures, it is customary. I'm going to the doctor and I'm bringing a spouse, I'm bringing a partner, I'm bringing somebody with me. And so making space, creating space for that is important. Providing materials that are written in accessible means. Sometimes as people experience health declines, they may not be able to assess information the way they did previously. information that maybe has a lot of written text may not be as helpful. So really understanding that people may be coming from diverse educational backgrounds, they may be coming from diverse linguistic backgrounds. And so modifying the information that you're giving them so that they can access it, so that they can use it for future encounters. And using terminology that conveys respect, right? I think if a client or a patient feels respected in the clinical interaction, that goes a long way. And it can be as simple as asking someone, how should I address you? Sir, ma'am, Mr., Mrs., cultural titles like chief, how should I address you? I think these are some of the strategies that we can use to help create practice that's a little bit more culturally sensitive.
I'm so glad that you lay out all this because it is so important the way you are being addressed in understanding your cultural background. And it's very common as human being for you to understand that certain people, the way you address them is very important to them. In order for them to receive the service that you're trying to help them with, you have to show some kind of empathy and understanding their background. And that's very important. And I'm glad you're able to lay it out because anybody who listens to this, it could be of a great help who are in this kind of field. So in understanding the connection between physical and mental health, can you explain, which you did a little bit, but explain how physical health and mental health are inseparable?
So that's a great question. Thank you again. I think one of the ways that this comes up for me often is when someone has a physical health condition that changes the way they can interact with the world, right? It can be really jarring. It can be hard to cope with what we might say is an acquired disability, right? So I'm using stroke as an example because of, my father's background and history and my desire to learn a little bit more about what adjustment to stroke looks like. But for example, strokes affect people differently. One of the impacts sometimes is partial paralysis, right? Loss of the ability to use your arm or your leg. Sometimes there are language impairments that make it really hard to understand or to use language, which means that you may not be able to return to work in the same capacity. What does that mean? Oftentimes what people say to me is they kind of refer to themselves pre-injury and post-injury, right? And that there's this kind of dichotomy between who I was before the injury and who I am now after the injury. And when the person that you perceive yourself to be after an injury feels like it is very different from the person you were before an injury, that creates some risk for sadness, frustration, anxiety that can be persistent. When you, in the example of depression, which includes not just sadness, but also sometimes irritability, kind of a social withdrawing, right? Changes to your sleep pattern, changes to your eating pattern, changes in your ability to concentrate, fatigue, sometimes negative thinking styles, thinking about yourself in negative ways that can unfortunately create more feelings of insecurity and low or diminished self-esteem. And in its most severe form, right, can lead to thoughts of self-harm. When you are at that space, how do we help you cope with that, right? How do we help you move out of that space? It's doable, and I think it requires being able to talk about it. And so oftentimes when you have a medical condition that makes it really hard to engage, this is a risk factor, right? It can make you more susceptible to experiencing some of these symptoms. Now, it is not a given, right? Everyone that experiences a health challenge is not necessarily going to also experience a mental health condition. There might be other risk factors that make it more likely that someone will experience a mental health challenge, like pre-existing symptoms of depression or anxiety that maybe went untreated, ongoing or chronic risk factors. Sometimes there are neurochemical changes that can make it more likely that you might experience a mental health condition. But I think the medical field continues to grow and continues to be accepting that oftentimes these two things are not necessarily inseparable. That if we can help someone with their mental health, then it's likely they are probably also at times going to have improved health outcomes. If you are someone who is managing a chronic illness and you are depressed, it makes it very, very hard to manage that illness. It makes it hard to take your medications on time. It could make it hard to get to your medical appointments. It can just make it hard to manage that illness. And if you're having a hard time managing the illness, well, what happens? Your outcomes become worse, right? And so if we can identify early on, right, in the recovery period that someone may be at risk, then we can help provide them with resources, at the very least with some education about here's what to look out for. And if you start to experience some of these things, here's who you can talk to.
That is so powerful. Thank you so much for that because, like you say, both is inseparable. We cannot separate physical health from mental health. When you have physical illness, it also affects you mentally. And in most cases, the way we might interpret things, because when you go to the doctor, they might ask you, are you having anxiety? What do Africans understand about the word anxiety, which also means worry?
Yeah.
And when you say, okay, are you worried? Worried is normalized that it's okay to be worried. There's nothing in terms of being worried. I remember talking to somebody years ago that somebody had anxiety, and he said, everybody have anxiety, is nothing to it, without understanding the extensiveness of it, which I had to explain
Yes.
level of the anxiety, what it means to actually have anxiety.
Yeah.
Level of it. Can you further explain how African immigrant interpret symptoms of stress, pain, anxiety, depression, and other mental health issues?
So I'll start first with anxiety. You're right. Anxiety, a component of anxiety is worry. And it is not uncommon for people to worry. Many people worry. We all worry, right? Something makes us worried. Those things are normal. But like you said, it's not necessarily just that someone is worrying. It's about the severity of the worry and how the worry impairs their functioning in different domains of daily living. I like to share with community members that worry is one component of anxiety, and worry alone is not sufficient for a diagnosis of anxiety. Anxiety is considered worry that is persistent and excessive, worry that's difficult to control, that might be accompanied with feelings of restlessness, irritability, fatigue, problems with sleep and concentration, muscle tension, and that causes significant distress or impairment. If something is happening in your life that may be causing persistent worry, right? And that worry is intractable and it is getting in the way of sleep. It's making it hard for you to function at work. It's making it hard for you to kind of take care of things around the home. That's worry that we should talk about. Yeah. That's more than just regular worry or everyday worry. Stress is common. I think we all experience stressors. There's a lot of research about chronic stress that is persistent, that again, oftentimes can create some of these same symptoms. We want to talk about that, right? We want to work with you. Are there ways that we can help you either cope with or reduce the stress or cope with the physiological manifestation? There are ways that we can help you cope with the worry. And I think depression is similar. Depression sometimes I think is conceptualized as sadness. And for many African immigrant communities and cultures and Black cultures across the African diaspora, depression might be more physiological. People might experience it like pain in my heart. And if you are a clinician and you're working with someone and they're a psychologist and they're saying, this experience is giving me a lot of pain in my heart. You want to pay attention to that. You want to have them talk a little bit more about that. What do they mean by pain in their heart? And what else are they experiencing? Right. Social withdrawal. I don't really feel like hanging out with my friends or talking to family members. That's important. We want to pay attention to that. Problems with sleep, problems with concentration, low self-esteem or diminished self-esteem or low sense of self-efficacy, right? Feeling like I'm not really able to overcome this stressor or I'm not really able to overcome this sadness. And like I said, as depression kind of becomes a little bit more severe, we can also see thoughts of wanting to die. Sometimes people might make passive comments like, oh, it would be better off if I had died. These symptoms together look like what we may call depression. Tell me a little bit about what you're doing to manage these symptoms. right? And they might say, oh, well, I'm praying. Wonderful. What else are we doing? Who are we talking to? Who are we not talking to, right? Are we managing our sleep? Are we watching managing our diet? What are we doing? Are we meditating? Are we staying engaged in activities that are meaningful? If these symptoms are really, really severe, have you considered medication, right? That's like a next level conversation. If you start talking to someone about maybe consider some medication, they'll look at you like, what's wrong with this person? Sometimes we need an entryway. Oftentimes the entry point, the starting point is really providing the education, making space for the conversation, and not equating someone's struggle with madness. And I can't tell you how many times I've said to folks, if I'm doing an interview or I'm meeting with them for the first time and we look at all the symptoms together and I say, these symptoms together really look like this. And I want to let you know that this is not madness. It's almost like a weight is lifted off their shoulder.
Yes, yes.
Yeah.
I,
Because
how it is so important what you just said. I remember this weekend I was with some group of friends and we're talking. I had a friend who went through childhood trauma of female genital mutilation, sexual abuse, name it, and all these things impacted her life later on.
was.
To the extent that it leads to other health issues.
Yeah.
And we're talking about what is mental health.
Mm.
And she said, I see my therapist all the time. This person just had a lung transplant.
Mm.
And she said, without my therapist and my religion, I don't think I'll be here. I don't think my mind will work well. I don't think I'll be able to take care of myself the way I'm taking care of myself.
Isn't that wonderful that she
Yes.
had that insight?
Yes. And my other two friends who dismiss mental health, mental illness as if it's not something that they think is important to address separately. So imagine that kind of conversation back and forth
Mm.
around somebody who believe in it, who said, without this, I won't be able to cope if I didn't address both my physical health and mental health, which is helping me to thrive. Also going through childhood trauma of what I grew up with. So we have to really educate our community. And I'm glad that you're bringing this conversation up because the level of dismissal, the level of ignorance when it comes to this discussion is huge.
I think there's just a lot that we don't know. And like you said, trauma is its own. We can have a whole nother podcast about trauma, right? Trauma is its own other risk factor for many different types of mental health conditions and also for physical health conditions. But if in our communities we don't talk about mental illness apart from stigmatizing it, it is still something that's very highly stigmatized, and it is very scary. I can imagine how brave your friend must have been to be able to say, I see my therapist regularly, knowing that she has friends that are going to be like, okay, I don't know what you're talking about. Because historically and culturally, how do we treat mental health conditions? Through religion and prayer, right? We say, okay, well, go to church, go to the pastor. Sometimes there are some narratives where a mental health condition can be viewed as punishment from the gods, right? There's something that you did not do. Different forms of spiritual attack. There's someone or something that is attacking you. And if you can improve your spiritual life, these things will go away. And that's not necessarily the case, right? It is, I think, because we just don't have the education, we don't have the language, we don't have the terminology. We haven't spent a lot of time talking about it. I think it's changing, especially with the younger generation. I think the younger generation is much more comfortable about talking about mental health and much more comfortable about prioritizing their mental health. And again, that is probably a function of acculturation, how long they've been in this country, their consistent exposure to the terminology, and their growing understanding that mental health really is a spectrum and it's varied and lots of different things go into mental health. I think when we move away from the idea that mental health is always a negative thing, right? That we're always trying to prevent something negative from happening, those conversations are a little bit easier because we can also flip it and talk about, well, how do we promote well-being? Like, how do we promote psychological well-being? What are the things that you do to keep your mind healthy, right? Or to keep your mental health healthy, prayer, socializing, meditation, engaging in valued activities, taking medication regularly as you should. Like there are things that you can do, right, to also kind of promote, positive psychological well-being. Maybe part of the conversation with our elders is flipping the perspective. And rather than talking about it as something to be avoided, maybe we'd start talking about it as, well, how do we promote something wonderful here? Because we are very growing more accustomed to talking about how do we stay healthy? How do we stay physically healthy? We have those conversations all the time and we know, well, you need to sleep, you need to take your medicine. These are the things that you do to stay physically healthy. And I think that we can do something similar for our psychological health.
And you mentioned acculturation. I want to talk about your first research, the association between depression, acculturation, cardiovascular health among African immigrants. Your research showed that immigrants should be studied separately from other Black population. Why is this important? And what do we miss when we combine this group together?
So I think historically there has been the misconception that the African diaspora is a monolith and that there is no variation amongst different groups of Black immigrants, particularly in the US. And we know that this cannot be the case, right? We know that there are different generations of Black individuals living in the US. There are differences in terms of culture within the Black culture, right? Like the Black culture is not one stable monolithic culture. There are similarities, right, across Black cultures, but there are also differences. And I think that if we continue to study, if we don't make space to look at those differences, then we miss opportunities for how we can actually tailor our intervention so that they are responsive to the needs of the individuals that we are working with. Because the culture, right, or cultural perspective that an immigrant from an African nation might be coming with to the US may be different in some ways than the cultural perspectives of an immigrant from Haiti, right? Or an immigrant from a Caribbean or South American country. And even if there are similarities, it's really important for us to know what are the differences so that we can offer tailored, measured interventions.
That's powerful. So, can you also unpack the growing evidence that linked depression to cardiovascular health? If you can explain that a little bit. Yeah, I'm
Yes.
going to get everything I can from you.
I will do my best to answer all of your questions. There is continuing research from the American Heart Association and from many researchers that there is this, what we might call like a bidirectional relationship with some cardiovascular health factors and depression. That could be for lots of different reasons, including just, biochemical makeup and biochemistry, as well as the ways in which people are navigating an illness, right? And so there's a lot of research that suggests that, there is an association and a relationship between your cardiovascular health and depression, and specifically. And so the research that you're referring to was my doctoral dissertation research, in which I really wanted to understand, what are the relationships between cardiovascular health, depression, and the role of acculturation. And acculturation and that, how are they interacting, different acculturation styles that they may be using to interact with the US culture. And what I found was that there was an association between depression severity, so how severe someone was endorsing their depression symptoms to be, and their cardiovascular health outcomes, so much so that individuals in this sample, so this was a sample of approximately 400 individuals that identified as being West African immigrants, that if they had 3 or more cardiovascular health risk factors, so things like tobacco use, high, overweight, obesity, um, endorsed diabetes or hypertension, right? If they had 3 or more of these cardiovascular health risk factors, they were also more likely to endorse moderate to severe levels of depression. This is a growing area of research, right, that I hope to continue to explore and understanding why did we see this relationship? What are some other factors that we might want to attend to? It could be for several different reasons, including that managing your health takes a lot of work.
Yeah.
Right. And in doing so, sometimes it's overwhelming. If you consider someone that might be managing diabetes, there are dietary changes, there are lifestyle changes, there are behavioral changes that they that they are required to make. And these changes can be really challenging and really difficult and really overwhelming. And perhaps there's a link there. So this is an area of continued exploration for me.
And I know you're going to continue to do it. So what does acculturation look like for older African immigrants, especially those with disability or chronic illness? For example, you talk about the diet, exercising that you mentioned. What does it look like?
So, in the literature, acculturation sometimes it's conceptualized or defined in different ways. Broadly, acculturation is defined as a bidimensional process. It's a process in which individuals may learn and or adopt certain aspects of the dominant culture. And so what that means is that as people are getting more and more embedded, right, in a culture, they're picking things up. Right? They're picking the cultural nuances up of their host culture and learning how that interacts with their culture of origin. And that can result in different kinds of acculturation styles. So the degree to which you are adhering to your host culture, your culture of origin, versus the degree to which you are identifying with your new culture, right? We hypothesize that for some individuals, the longer that you stay in a new country, the more likely it is that you might start to adopt, right, some of the cultural behaviors of that new country. We can see that in shifts in generational shifts. So, whereas individuals in my parents' generation, right, may be more likely to adopt or adhere to certain things within the American culture, my generation may be way more likely to do so. And we can also see some research that this can also be a function of when or age at migration. So someone who migrates to the US in their 70s may have a very different acculturation pattern than somebody who migrated when they were a young adult. They may be, the individual that's 70 years old may be more likely to adhere to aspects and things within their culture of origin than to adopt, right, or assimilate into their new culture or the culture of their host country. So that's a broad definition of acculturation.
It's just to look at how the acculturation in terms of in a new culture also affects mental or physical health as well.
So if we were to look at food preferences for an example, we can see that for some individuals, the longer that they stay in the US, the more likely they're to adopt food and dietary patterns of an American culture, which may have been vastly different from the food and dietary patterns that they had in their culture of origin. And we know that dietary behaviors are one factor in promoting physical health. We see these changes also generationally, that people may be more likely to adopt some behaviors than another. And it's the same thing with mental health. So whereas people maybe who have not been in the US longer, who come from countries where mental health is highly stigmatized, may be less willing, right, to talk about their mental health, may be less willing to seek access for mental health services than someone who maybe has been here 20, 30 years and has become really accustomed to talking about or thinking about mental health in a broader perspective. And so acculturation can, in some ways impact how you are interacting with your host culture.
Culture. Thank you. So I'm going to go into your next research, access to mental health care services as a risk factor for cardiovascular and cerebrovascular disease mortality. You did that research as well. So what motivates your involvement in this research?
So this was an abstract that I submitted to the American Heart Association, and we were able to present, myself and my co-authors. And again, really wanting to think more and more about the link and the relationship between mental health and cardiovascular health. Being able to address your mental health is multifaceted. In order to address mental health, you need to also have access to mental health care providers. And so, there's some research that suggests that in general, lack of access to healthcare services is predictive of poor health outcomes. And so for individuals who may be struggling with a mental health condition, lack of access to needed mental health services can create real and significant challenges in addressing several aspects of your health. And so it's important then for us to create this awareness, because what it says if the research shows, right, that when you do not have access to these needed mental health care services, not only does it negatively impact your mental health, but it also has a negative impact on your physical health outcome, then there may be broader push to get people more access to resources, get people a little bit more accustomed to like, how do we connect folks to care? I think that we see this model of attending to and trying to get people access to care and healthcare systems that are using screenings, right, for mental health. And so oftentimes a screener might be the first step into getting someone connected to care. Screeners may be the first time that someone even has a space to discuss what they may have been experiencing or what they have been experiencing, right? And to really explore what it might mean to address some of these problems. So I think there's a lot of awareness about mental health, and more people are becoming really comfortable discussing mental health care and seeking access. Again, I think there are going to be generational differences, right, in who is likely to seek and utilize mental health care services. I think there, again, is a much greater comfort in seeking these services among, the younger generations than maybe the older generations of immigrants.
Yeah, that is so true what you said. And I see many healthcare systems now include, I think you mentioned it before, mental health screening during medical checkup yearly.
Yeah, a common one is screening for depression.
Depression. To me, some of the questions are so vague. Like, it's not really going deep. It's just like, let's rush through this and let's get it out. How does cultural misunderstanding among African immigrants, such as normalizing stress and not understanding anxiety, affects this screening? In many occasions, doctors don't even have the time to actually sit down and talk to you. I remember last month I went for my regular physical checkup, and the doctor spent about 5 minutes with me, just go in and out. That they don't even look at you straight in the eyes and actually have a communication with you. Every minute counts.
It's so interesting that you say this because we talked a little bit earlier about behaviors that providers can do that convey cultural sensitivity. And just in that interaction and what you shared with me, you said, my provider didn't make eye contact with me. I didn't feel like I had enough time to really discuss my concern. Again, these are small interventions that we as providers can do that can help people feel more comfortable in a healthcare or a clinical encounter, and that can create the space to say, this is something that I've been worrying about, or this is something that I really want to follow up about. And then now we can start to get people linked to care.
What does cultural sensitivity look like, from informed mental health care? So effectively, especially for African immigrant, as a provider, I understand that you're talking to somebody of a different culture. I mean, It's not as if doctors are going to learn everybody else's culture, but,
No.
understanding that in some culture, the way you address them is completely different, or you have to understand how to communicate better with them.
Yes. And I 100% agree, right? It would be hard for any provider to learn everybody's culture. And it is important for us, again, right, to come into those interactions with humility and an understanding that I'm a cultural being and you're a cultural being. And what would be helpful for you in this clinical interaction so that we can help you get your needs met. And then everybody comes in with an agenda. You have an agenda. You want to understand, what's going on with my health or how can I address this? That's your agenda. Maybe the clinician has their own agenda. I need to make sure that they understand this and they understand that and that they're going to do this follow up. And so there are ways, I think, to create collaborations, right? Collaborative communication between the patient and the provider so that everybody's agenda gets addressed. I think to your earlier question about screening, right? Like screening can be a really wonderful tool, but like you said, if someone is underreporting, right? They, because of the way that the screeners are worded, you said, it's really vague. I don't really understand what they're asking here, asking me here. Someone may not report the symptoms to the degree that maybe would kind of indicate we need to follow up here. And, health systems are always evolving. And I know that one factor that is really challenging is the time that a provider has to spend with their clients. But it may be helpful, right, to just make a little bit of time to look over that screener, right? If you're going to give the screener, maybe we spend some time looking over it and saying, hey, I noticed that you checked this. Can you tell me a little bit more about what you meant?
Yeah.
right? And that can create space to have someone tell you about their conceptualization of stress, right? And if you're listening to this person's conceptualization of stress and you go, wow, that sounds like it could be really challenging. It sounds like it could get in the way of this and it could impact this and it could impact that. And they go, yeah, I have noticed that because I'm really stressed, I'm not able to sleep properly. Or I notice that when I'm really stressed, I'm not eating as much. Well, now we can intervene. We can say, well, we have specialists that can help talk to you, right, about how to better manage stress versus this is a mental health condition. Let's get someone involved. I think understanding where someone is in that process, it's easier for someone to say and agree to maybe having someone talk to them about different ways to manage stress than it is, depending on where you are and your understanding of mental health, to say these might be an indicator of a mental health concern. Let's get someone involved. That can be a harder sell. So I think it's okay to normalize. A lot of people are experiencing stress, right? We're living through really stressful times. We have someone on our staff who does a wonderful job talking to folks about the different strategies that they can use to manage stress or the different strategies they can use to improve sleep. It only takes a few minutes. You think you'd be willing to just talk to them for a few minutes. And then you can have a mental health specialist just come in and introduce the concept or just come in and provide some education and say, here you mentioned some of these things on your screener. We have a body of education about it. This is what I pulled up for you. Let's review it, right? And if you have any questions, please feel free to reach out.
I am not even sure whether some of these hospitals are just, okay, we're done with you. That's it. Fine, go out your way. Because if you really care, you won't give me a paper just to fill out and give it to the clerical staff in the front, and that's it. Maybe the doctor look at it, but for you to go through each one of it and make sure that the patients do understand what is being asked so that you adequately, be able to explain.
I think the ultimate goal that many healthcare facilities are aspiring to is on providing cultural sensitive care, on providing care that is patient centered. And so if we are screening for these things, I think that the aspiration is that we can also follow up, that we are also able to provide space to do that. I think a lot goes into that, including training providers, training staff, and, you don't just interact with the doctor. You interact with so many people across the healthcare continuum. You interact with the person that's checking you in at the administrative desk. You're interacting with the nurse or the nurse technician that took your blood pressure. There are so many, I think, interaction points, and which means that there are many wonderful points of intervention along the way where we could provide education or do a check-in. Many healthcare systems are aspiring to. How do we do that? You're
Thank
welcome.
you so much, Dr. Nmezi, for that. So I want to go into your final research that I have on file that talks about this research is based on depressive symptoms in older African immigrants with mobility limitation. Actually, maybe you must have explained it before of why you participated in this research.
Again, part of my focus is on understanding how to help people adjust and cope with acquired disability. And there might be several different reasons that someone has limitations in mobility. But what does it really mean? If someone is experiencing limitations in mobility, it also means that they may be more at risk for social isolation. They may be more at risk for not really being able to connect to people or to engage in activities the way they did prior to a change in their mobility status. And when that happens, is there an effect on your mental health? For some people, the effect can be depression. And again, there's not enough research on the African immigrant community, but there is growing research. There are wonderful African immigrant researchers across the US that are really looking at important indicators of health and psychological well-being. And it is important for us to continue to do this research so that we can inform policy, we can help shape patient and clinical interactions. The ultimate goal is then to improve health outcomes. But if you are able to understand, right, how, changes in mobility, may be a risk factor for depression in aging population, it gives us wonderful room to provide tailored education, right? For how you can cope, right, with these changes and what to look out for. What kind of changes in your mood or your sleep or your diet, like what kind of changes should you be aware of that then help you say, I think maybe I need to talk to someone or I need to seek additional support. And I think that, as the research grows, the way in which we support, right, the way in which we design and develop support will probably be culturally informed.
And that's so important. And the paper also mentioned, the last one, that the trauma, including forced migration, might also affect long-term mental health care. Can you briefly talk about that?
We know that people migrate to the US for lots of different reasons. And for some people, they may be coming from areas, of the world where they may have had high exposure to trauma, right? And we know that high exposure to trauma, while many people will be resilient, some people will develop some mental health conditions like depression, like anxiety, like PTSD. There can be factors across the continuum of migration that might serve as triggers, right? How that trauma might come up again. And if you are an older individual, maybe migrating at a later instance in life that is now experiencing some of these symptoms, it's hard to know how to navigate it. And part of understanding how do you help people navigate it is to study it, right? Study what are the factors, study what should we as clinicians and researchers really be attentive to.
Yeah, that is so true. And, with your expertise, knowing, all this advice and everything you share, what advice would you give to those who are working with African immigrant community in healthcare field?
I think one of the things that I would say is be open to inviting culture into the room. Be open to asking individuals about their understanding, especially if you're talking about when you're addressing sensitive topics like mental health. Leading with the understanding that might be a really difficult topic to talk about. And there's some information that I want to share with you. And here is the information, and I want to also understand what are your thoughts on this information. Is there any other information that you think would be helpful or beneficial for you or a family member or a friend? And so really making space for the conversation and also understanding that for some people, depending on where they are in terms of acculturation or length of stay, these are hard conversations to have.
Yes.
So this may not necessarily be a conversation that you want to have in 2 minutes, in and out, because there might be lots of questions that come up that you really want to be able to make space to feel. And so understand in the clinical interaction how you utilize time, especially if this is going to be a short interaction, utilizing your time effectively to enable you to talk about these topics at the same time, making sure that people feel heard and not judged, right, about what they might share. And with the awareness that you may be the first person that has actually ever asked them about their mental health. This may be the first time that they are talking about it. Yeah.
That's so true. And what is your advice to African immigrant community when it comes to understanding of mental health and mental illness and the stigma surrounding it? Because many of the stories you told were so powerful. And it's
Thank
time
you.
to now continue to normalize mental health and mental illness
Yeah.
conversation within our community.
No, I would say that a focus on your mental health is just as important as a focus on your physical health. And focusing on your mental health is not a negative thing, right? All of us, right, have mental wellness along a spectrum. And based on the social, economic, structural factors or barriers that you are facing at any given time, you may experience some challenges in your mental health. And that does not mean that you're going mad. That means that you're a human having a human experience that at times is challenging and difficult, and that it is okay, right, to talk about the way you're feeling, especially in spaces that feel safe. I think that while we are all aware of the stigma that is behind mental health and mental illness, sometimes we can identify that one person that one family member or that one friend that is a safe space that enables you to talk about what you are going through. And if it is serious, if you are struggling with your mental health in a way that makes you significantly worried, it's okay to reach out for additional assistance. There are national hotlines that are ready and have been established to provide people with immediate help. Right? If you had a physical health emergency, you would call 911, right? You would call 911. And I tell folks, if you're having a psychiatric emergency, if you're having thoughts of self-harm, if you're having thoughts of wanting to take your life, dial 988. Okay? There are systems that have been developed to help you. You don't have to do this alone. We don't want you to do this alone. And your mental health is just as important as your physical health.
Thank you so much, Dr. Nwakaego. Thank you, thank you. I mean, your closing statement actually hit home. And I hope, I pray those who will listen to this, okay, will take this important information and use it as a way to continue to empower our community and ourselves about the need to take care of both our physical health as well as mental health.
Yeah. It was a wonderful discussion. I'm so glad that I was able to participate and that you invited me to be here with you today.
Thank you, Dr. Nwakaego, for this powerful and eye-opening conversation. Today's episode reminds us that for African immigrants, health is more than just a medical issue. It is shaped by culture, migration, trauma, beliefs, and the reality of navigating life in a new country. By understanding the connection between mental and physical health, recognizing the early signs of depression, anxiety, and breaking the silence around stigma, our community can begin to heal in a way that honors both our heritage and our lived experience in the diaspora. Dr. Nmezi, thank you again for helping us understand how mental health and physical health are interconnected and the impact on our well-being, and for reminding us that on wholeness of self-care, both physically and mentally. To our listeners, thank you for tuning in. If this conversation resonates with you, please share it with other people, your family member, friends, and community group. This discussion saves lives and they help us build a healthier and more informed African immigrant community. Be sure to follow, subscribe, leave a review to help this podcast reach more listeners. Your support allows us to bring more conversation like this that is grounded in research, culture, and community empowerment. Until next time, stay well, stay informed, and take care of yourself.
Thank you for tuning in to this episode of Ponza Ponza Live Podcast. We hope to have you back with us in the next episode as we continue to explore the nuances of the African immigrant experience. If you'd like to connect with us, you can email us at talk@ponsaponsa.org. That is talk@pansapansa.org. And follow us on Instagram at pansa.pansaforum. Until next time, remember to spread kindness and love. Thank you and take care of yourself.